Welcome to this episode of the Asher Podcast. I'm Fred Wyan, Director of Communications with the American Sexual Health Association, ASHA. In this episode, we're talking about some big news in the world of the prevention of sexually transmitted infections, an update on the use of the antibiotic doxycycline as a means of preventing bacterial STIs, specifically gonorrhea, chlamydia, and syphilis. Our guest is Dr. Philip A. Chan, an associate professor in the Department of Medicine at Brown University. Dr. Chan is also a physician at the Rhode Island Department of Health, also serves as Chief Medical Officer of Open Door Health, the state's only LGBTQ plus health center. He also has his own podcast, Public Health Out Loud. So I'm hoping maybe we can work a little cross promotion here. But Dr. Chan, welcome to the ASHA podcast. We're really glad to have you.
Thank you so much for having me.
Good deal. All right, so let's get to it. In early June, just about a week ago from when we're recording this, the Centers for Disease Control and Prevention, CDC, published guidelines on the use of Doxy PEP to prevent the bacterial STIs that I mentioned, specifically in men who have sex with men and transgender women. And Dr. Chan was an author on these guidelines, so he's the one we need to talk to. Let's start with the basics. So would you just talk a bit about the concept of PEP and the use of Doxy to prevent these infections? What is Doxy PEP?
So, Fred, this is very exciting. I think, as we all know, bacterial STIs have really been increasing significantly over the last couple decades. And we're talking, of course, about syphilis, chlamydia, and gonorrhea. And doxycycline really is one of the first chemoprophylactic medications to prevent these bacterial STIs. So it's very exciting. And many of us hope that this will sort of be a game changer as we talk about addressing STIs. So when we talk about this medication, doxycycline, so doxycycline, first off, is a very common antibiotic. It's actually been approved by the FDA here in the United States since 1967. We have lots of experience. Lots of people take it for lots of different reasons, including things ranging from acne to a lot of different bacterial infections. It's also the first-line treatment for chlamydia treatment, and it's a second-line treatment for syphilis, and it has activity against gonorrhea. So someone had this brilliant idea to use it as actually a preventive medication against these bacterial STIs, and it does just that. It works in terms of preventing these bacterial STIs.
Okay. So what is PEP? I think it's post-exposure prophylaxis. Did I say that correctly?
You did, yes. So it does get a little confusing. And in fact, I think a lot of people sometimes get confused about this. You know, in the field of HIV prevention, right, we have PrEP or pre-exposure prophylaxis. So pre stands for before you're ever exposed, you're going to be taking a pill a day to prevent HIV infection. Post-exposure means that you're going to take something after an exposure. So doxycycline has been studied now as post-exposure prophylaxis. And basically the concept is that after you have sex, and that includes anal, oral, or vaginal sex, you take a dose of doxycycline at 200 milligrams, ideally as soon after, ideally within 24 hours, but up to 72 hours. And it's been shown to be about 80% effective in preventing syphilis and chlamydia, and about 50% effective in preventing gonorrhea.
Those are some pretty good numbers. Let me ask you, why is Doxy PEP currently recommended only for men who have sex with men and transgender women?
So we have seen a disproportionate burden of bacterial STIs in that group. And I think the studies really focused on those groups to begin with. I think that's important to note. If you look at some of the, pharmacodynamic studies that have been done, we do see, for example, that doxycycline builds up in significant quantities in the cervix and in the cisgender female reproductive tract. So we do expect that doxycycline will also work as post-exposure prophylaxis in cisgender females and transgender men and other people that have a vagina. I think the one slight challenge, and I don't want to call it a setback, but somewhat disappointing, was there was one study called the DoxyPEP Kenyan study done out of Kenya that looked at DoxyPEP in cisgender heterosexual women. And unfortunately, it did not find that it worked. Now, when people analyzed and dove into that study, they found that it was likely because people that were supposed to be taking DoxyPEP weren't taking it. So it was an adherence issue, not so much of the fact that it didn't actually work. However, because of that, and also because the CDC is really focused, of course, on evidence and making recommendations that are really evidence-based, the evidence isn't quite there yet for for cisgender females and other people that have a vagina. Now, that being said, certainly as a physician myself, I've had lots of discussions with cisgender females, people that I think that are at risk of bacterial STIs, and I do prescribe it on a case-by-case basis. I think that CDC just there wasn't enough evidence to make a broad recommendation for it.
Okay. Would you mind defining cisgendered female? What does that mean?
Yeah, of course. So cisgender, in the gender world, we talk about cisgender and transgender. So cisgender means that you identify now as the same gender that you were born with. So we talk about the sex that you were born and your current gender identity. Transgender person is someone that was born a different gender than what they identify with now.
Okay, thank you. Um, Getting back to the populations for whom Doxy PEP is recommended, this is not a blanket recommendation for all men who have sex with men and transgender women, right? There's a nuance to it. How do you sort out within those communities which patients may be the ones who could benefit from this?
Yeah, it's a great question. And if you see, if you read the CDC recommendations, and there's a lot of discussion about this internally, the wording specifically says that men who have sex with men and transgender women who have had a bacterial STI diagnosed in the last 12 months should receive counseling about Doxy PEP. And then it further goes on to say that the CDC recommends that there should be shared decision making between the provider and the patient about prescribing doxypep. So it's not necessarily saying that all right that all men who have sex with men or transgender women should be on doxypep, but it is saying that everyone should know about it, especially people that have had a past bacterial STI, and then through this process of shared decision making, which frankly we should all be doing anyway.
Okay. Let me when I ask you why these guidelines are specifically for men who have sex with men and transgender women, you talked about how they are disproportionately impacted with these particular STIs, and I wanted to just explore that with you for a minute, if that's okay. Why are these populations vulnerable? I'll just throw that out there, and then I can respond. But why is this such an issue with these populations?
Yeah, it's a good question. For as an example for syphilis, we do see a high number of cases in men in general, and specifically gay and bisexual men, other men who have sex with men, and it's really a multifactorial reasoning, right? So once these are infections, once they start in the population, they get concentrated. It's a network effect, right? So people, if you're having sex with other people in this group, then you're just more likely to come across it. Some of it has to do with the association of HIV infection. I think, as you know, we see a higher number of HIV cases still, unfortunately, among gay and bisexual men. A lot of times we see syphilis transmitted along with HIV. And then there's other factors such as substance use, such as condom use, et cetera, et cetera. So it's really a whole host of reasons of why we see these bacterial STIs at higher prevalence. I will say though, Fred, I think to your point and what you're getting at, and one thing that I worry about, of course, is that in women, cisgender women, people that do have a vagina, we do worry more specifically about chlamydia and about gonorrhea in that group because, of course, they're at risk of more significant sequelae of those infections, things like pelvic inflammatory disease, ectopic pregnancy, infertility, et cetera. So I do worry more about those infections, especially in cisgender women. Syphilis, of course, is a nasty infection no matter who gets it, and we definitely see pretty significant complications of that.
Yeah, and I know the CDC surveillance data that came out earlier this year talked about the jump in the number of congenital syphilis cases, syphilis among newborns. And so, yeah, there's a lot to unpack with all of these infections. Let me ask you one more thing on this topic, if I may, before we move on. You talked about some of the reasons why MSM and transgender women are disproportionately impacted. How much of this gets back to social determinants? I mean, what got me thinking about that is the Open Door Health Clinic that you run. It's an LGBTQ plus clinic. I imagine that's pretty welcoming. I imagine it's very well attuned to its patients, but not all clinics are, right? I mean, how much of a barrier is that kind of thing?
I do believe it's a significant barrier. I see a number of patients that unfortunately have not felt comfortable going elsewhere. Even this past week, I've seen people that haven't engaged with a provider, a physician, a clinic in the last couple of years because they just haven't felt comfortable or they've had bad experiences. So, just as we talk about systems approaches and structural determinants of health, all of us really need to create settings, atmospheres, clinics, organizations that are welcoming and respectful at the very least, and certainly affirming. And I do think that that's a big barrier, especially for the LGBTQ population. We're recording this in June, so it's Pride Month, celebration of the LGBTQ community, and I think it's a big thing. So I think as we think about how to improve access for sexual health, for STI care, really striving to make our clinics and our settings as welcoming and affirming as possible.
Okay. All right. Here's a question more on the clinical side. So Doxy PEP is not just a one-time intervention, right? Would you talk about what kind of follow-up testing is needed and why that testing is so important?
Yeah, so doxycycline, as I mentioned, it's been approved since 1967. So we have a lot of knowledge and experience with it. It's relatively cheap, so that's a good thing. So HIV PrEP has been expensive, and that's been a barrier. But the good news is that doxycycline is a little bit an older medication, so it's cheap. I am reassured and actually optimistic about its use as post-exposure in terms of minimizing side effects and adverse events. So, doxycycline in general is a very safe medication. When we talk about this antibiotic, some people can have some gastrointestinal symptoms, things like nausea, vomiting, abdominal discomfort. Some people can get a rash on it. Some people can potentially feel a little bit dizzy, etc. That's in a small number of people, but most people don't have anything. That being said, I am certainly reassured that people are taking it periodically. So, as post exposure, these studies that have been done that have looked at sort of these adverse events on doxycycline were people that were taking it every day. And so, obviously, if you're taking the medication every day, you're going to have more side effects. So, hopefully, we do see people tolerate this medication. Again, it's very safe. And I'm also reminded too that doxycycline has been prescribed as a malaria prophylaxis
Hmm.
for people going overseas. So people do take this medication for months and months, and it's also a medication for acne treatment. So again, people are on this for months and months, if not years, in some settings.
Okay. And if you were to prescribe Doxy PEP for a patient, when would you want them to come back? Come back in a month, come back in 3 months? How often would you want to see that person?
The other piece of good news about doxycycline is that um, there's not a lot of laboratory monitoring that has to happen. For people that we prescribe doxypep to, we do recommend that they come in every 3 to 6 months for STI testing. And that's one thing too that the CDC guidelines really point out is that doxypep, it's one of many different approaches that we need to use for STI prevention. And that includes STI testing as well. It includes vaccination for things like Mpox and HPV, encouraging condom use, et cetera.
Okay. All right. Um, so, all right. So you touched on some of the side effects. It sounds like most people don't have a lot of trouble, if any, with Doxy, and they tend to be so. I mean, once the person's no longer taking the medication, they tend to go away. So that is really good news. I want to ask you about this idea of antimicrobial resistance, or put another ways, we hear a lot about like antibiotic resistant gonorrhea and how certain types of gonorrhea are becoming, they're just not, the antibiotics don't work as well with them anymore. Is there anything to think about here? Are we overprescribing antibiotics, or are you worried about that at all?
It's a great question. And the answer is yes, we worry about antimicrobial resistance all the time for lots of different things. Doxycycline is an important antibiotic. As an infectious disease physician, we do use doxycycline for a whole host of things. It's one of those antibiotics that also treats a lot of unusual infections. We use it to treat things like Lyme disease. We use it to treat Staph aureus infections, just a whole range of different infections. So we, of course, want to be judicious in its use. And this is one thing that has been cited as a concern. It's something that we do need to watch closely. It's something that we need to stay on top of. as public health organizations, as clinicians and scientists, and we want to use it judiciously. Uh, you know, in terms of gonorrhea, we are concerned that we will see some increasing resistance there. That is the bacteria, the infection that we do worry the most about. The good news is that we really haven't seen much resistance to doxycycline, really any, in syphilis or chlamydia, so that's reassuring. And I'm also a little bit concerned about resistance in some other infections too, some sort of unintended consequences, things like community-acquired MRSA, methicillin-resistant Staph aureus, some of these other commonly prevalent infections like MRSA are generally sensitive to doxycycline. And in the clinic world, we use a lot of doxycycline to treat things like, community-acquired MRSA. So if we do see some resistance there, that could definitely make it harder to treat some of these other common infections that we see.
Okay. You touched on this earlier when you were talking about the Doxy PEP studies with cisgendered women. If you were to gaze into your crystal ball, do you think we'll see Doxy PEP recommended or approved for other populations at some point? What do you think?
I do think that we will. I know that there's some studies that are starting up looking at cisgender women, people who have a vagina, and I do think so. I think in the real world, a lot of my colleagues, myself included, will be prescribing doxypep for women on a case-by-case basis. Now, the recommendations again are for men who have sex with men and transgender women, but again, there's no reason to expect that this won't work in women.
Okay, fair enough. So the last thing I want to ask you about is, well, we always like to try and offer our listeners, our viewers, some practical tips they can use. So in the show notes, we're going to link to your podcast. We're going to link to the Open Door Health Clinic. We're also going to link to a CDC clinic locator, so no matter where people are, they can find some help. But let me ask you on that. What tips would you recommend to empower patients? Like, should they proactively ask for doxypep? And if so, what do they say to the provider? How do they break the ice in that conversation?
It's a great question. I do think that some people should proactively ask. I think when there's a new thing that's out there in medicine, sometimes doctors just haven't had a chance to catch up. So I think sometimes as a patient, it's great to be proactive, to do a little research and to kind of push your provider, physician, or otherwise about things like doxypep. And doxypep is really new. And the other point that I'll make too is that, I think a lot of people are concerned about HIV and getting HIV, rightly so, even though HIV is more of a chronic disease now, great medications to treat it. But some of these other bacterial STIs, and I'm thinking specifically about syphilis, can really cause significant long-term complications. And so I'm really optimistic about doxycycline as post-exposure prophylaxis. I do think that people should consider it, especially if you've had I think for sure, if you've had multiple bacterial STI infections, there's no doubt in my mind that you should really get on it if you continue to be sexually active. I think if you've had one bacterial STI infection in the past, then it's worth having a discussion depending on your current sexual activity. And I think that if you have, more than one partner and are not in a monogamous relationship, then it's worth considering whether or not you're male or female to just be aware about it, look into it, have an educated discussion with your provider to see if it could be right for you.
Okay. Dr. Philip Chen has been our guest today. Look, thank you for your time. And I imagine we'll come back to you as we learn more about doxypep when these programs ramp up, right? We'll see exactly what it's like more in the real world, I guess. And of course, if there is approval for other populations. So this is probably an ongoing discussion. I know you'll be looking at some of that data pretty closely yourself, right? So thank you for that. I mentioned your podcast, Public Health Out Loud, which I know is available through Apple and iHeart. I'm assuming Android as well. So we'll link to that and take a listen, folks. Thank you, Dr. Chan, for your time. Thank you, intrepid listener, for tuning in this conversation. Check back with us often because we roll things like this out all the time. Send feedback, including ideas for future podcast episodes, info@ashasexualhealth.org. And until next time, take care, everybody. Bye.